Sad day for all Canadians. Program, by the way, brought to you by Pete's Pizza. Tragically, HIP's official statement came out today about Gord Downie's cancer diagnosis, and the technical side of it is one that might be confusing many. Why don't we have a doctor and let us know what's going on with Gord? Thank you, and welcome back to the program. Good friend of the show, Dr. Brett Belchetz. You know, tough news. Are you a HIP fan? Are you a Tragically HIP fan, Brett?
You know, I used to be when I was younger. I remember way back I would know all of their songs, listen to all their albums. It's something that I really don't listen to so much, but honestly, they are just an incredible act, and you know, the performances they put on, the music they've created are just, you know, an unbelievable thing. So this is a huge tragic story, I think, for all of us to hear about. So, you know, the word tragic and the word terminal are sort of these two words that most Canadians can't sort of fathom and understand, yet he's going on tour, we hear. So maybe you can just explain to us what actually is going on. Mm-hmm. So he received a diagnosis of something that's called glioblastoma. And from what I understand, he received the diagnosis in December of 2015. And this is one of, unfortunately, the most common brain tumors that we see in adults. And what is awful about this brain tumor is it's also the most fatal and the most difficult to treat. So the prognosis is actually quite terrible. It almost never responds to treatment. The average time of survival with best possible treatment is usually about 12 to 15 months. So what we're looking at is, you know, he had a diagnosis in December of 2015. Really, you know, I would guess spring, you know, early spring of 2017 or so is probably about as much time as we're going to get here. And it's an awful, awful thing. And now his doctors have gone through the standard treatment of this, which is surgery plus chemotherapy and radiation, which is the standard for this. And what that achieves is it takes the survival from about 3 months without treatment out to that 12 to 15 month time frame. But that's about as much as it can achieve. So this is just one of those diagnoses that, you know, we've made a lot of strides in cancer treatment, but this is one of these ones that's been very, very difficult to treat for a number of reasons, which we can get into later. But really just an awful, tragic diagnosis. And it is great that he's out there doing as much as he can with the time that he has left. I guess I didn't realize how grave it was. I think for the average layman, and maybe I'm speaking on behalf of too many, and I'm generalizing here, is it? I guess it's shocking to think that you could go out, go on tour, do 3-4 hour shows, exude that kind of energy, but yet still be so sick and knowing that it could happen. So, I mean, is this something that is right now currently kept at bay, but will just grow back? Well, pretty much yes. So what happens with the treatment for this? So, you know, the idea is that you go in with surgery and you want to cut away as much of the tumor as possible. Now, that's very difficult to do in the brain because the brain is one of those parts of the body that just doesn't recover from injury very well. So surgery is very limited. You usually can't cut away very much of it or all of it, but you do your best. And then you follow up with chemotherapy and radiation. But unfortunately, with this kind of cancer, almost always there's parts of the tumor that are left behind that will regrow. And there's only so many times that you can do chemotherapy or radiation. And typically what ends up happening is after chemotherapy, the parts of the cancer that are left over are usually resistant to chemotherapy. So it's those cells that didn't respond the first time that are now growing, and further rounds of chemotherapy tend to not have much of an effect. And so the thing with brain cancer as well is that it's one of those things that in the early days, the symptoms can be more nuisance symptoms. So people can have headaches, they can have some visual problems, they can have some personality changes and a number of other symptoms. But for the most part, it isn't something that is going to affect somebody's life in a huge way. Now, the problem with brain cancer and why it can be fatal so quickly is as the cancer grows and it starts to put pressure on the brain itself, it actually starts to compress vital structures that are essential for us to survive. So eventually, as it puts pressure inside the skull, it blocks the drainage of fluid out of the brain. It causes compression of the areas of our brain that allow us to breathe, that allow us to speak, that allow us to eat and drink or even move the rest of our body. And that is why these are very quickly fatal. Oh man, it not to sound so morbid, but it just sounds like there's suffering that's involved with this. It is a terrible diagnosis, and I've seen a number of patients with this, and once it really starts to take hold and the decline starts to take hold, there's a lot of suffering. So this is one of those things where patients at the end, they do tend to really suffer in terms of their loss of independence, their loss of mobility. Often there's terrible pain associated with it. It's one of those things where when we see this happening, there's our hearts really go out to these patients because, it really gets to a point where their life is reduced to really just counting down the days towards the end. So, again, I say, the fact that our treatment can extend the survivability from, 3 months out to 15 months at best it is great that we give people a chance to do the things that they love, to say goodbye to their loved ones, to do the things that really matter to them, and that's what they need to do at that time. So the treatment is helpful in that way, but overall, towards the end, this is a horrible, tragic illness to observe.
With the advancement in medicine, very rapidly changing so quickly, and with technology and stuff, is there any hope, Dr. Belchetz, and thanks for joining us, by the way, that is there any hope that, within these 12 to 15 months of a prolonged life right now for Gord Downie, that maybe there could be some optimism?
Well, I think the only thing that's on the horizon that may give some hope, and again, I would temper any optimism strongly, because
Okay.
I think the chance of this making a difference is minimal. But, one of the big obstacles to providing effective chemotherapy against cancers in the brain has always been this thing that we call the blood-brain barrier. And I don't know if you've heard of that term before, but essentially all of the blood vessels that are in the brain are essentially surrounded by an insulating network, and a lot of chemicals that are in the bloodstream that could get to other parts of our body, unfortunately, cannot make it out into the brain tissue. And this is a really smart thing to have, because it protects our brain tissue against a variety of insults, but it's really bad when we're trying to get chemotherapy agents in, because they are unable often to cross that barrier. But what's really interesting is actually just over the last year or so, there have been a couple of really promising new techniques developed that do allow drugs to potentially cross the blood-brain barrier. And some of those were actually developed specifically with the idea of treating Alzheimer's disease, but there's no reason that those same techniques couldn't be applied to cancer treatments. Now, they're very, very early stage. They're very much in the research part of their life. They haven't been proven out, and especially they haven't been proven out with regard to cancer. But, were we to make some great strides, were there to be clinical trials involving some of these techniques, there is a small chance, but I would say it's a very, very small chance. And, we really shouldn't be hanging our hopes on there being a miracle treatment that comes out in the next 12 to 15 months.
Are there reasons as to why this type of cancer exists? And from what I've read as well, and you mentioned it earlier, that men from about 40 to 60, it seems to be growing at somewhat of an alarming rate in terms of taking a loss of life?
Well, there's been a lot of research into what the causes of this cancer are. And unlike a lot of other types of cancer where we have a very good understanding of what the risk factors are, to date, it's been very difficult to identify specific risk factors for this cancer. So, we've looked into genetics, we've looked into environmental factors, we've looked into exposures, diet, exercise. None of them really seem to have a tremendous effect on the incidence of this cancer. So it's one of those things that, it's a huge number of people that are affected. It's a very deadly disease, but we still don't fully understand why it happens, what puts you at risk for it, what you can do in your life to minimize the chances of coming down with this.
When you say a huge amount, are there some statistics based on this that you might know of?
Well, when we look at this particular cancer, so it comprises about 15% of all brain tumors, so it's the most common brain tumor out there, and it is certainly one of the leading causes of death from brain tumors, for sure, given its most deadly nature. We don't keep specific statistics in Canada for the incidence of this cancer. So I can tell you in the United States, I believe there's about 2,000 to 3,000 cases of glioblastoma every year. We could probably guess that for Canada, given our population is 1/10 the size, it's probably on the order of 200 to 300. So a fairly significant number of people in this country for sure are affected.
Wow, it's talking to you, it makes me sad, and sad for anyone going through cancer. I don't want to weigh one any differently. Is there ever a fear sometimes, and I apologize if I'm taking away any of the sensitivity away from what potentially obviously would be a loss of life from one of Canadians' biggest legends, but do some people sometimes get in a paranoia state when they hear announcements like this? Oh, I got a headache, or I did this. Like, is there anything you want to caution a listener of, or maybe lead them towards going to see someone in case they do think they are suffering from something?
Well, we certainly see a spike in awareness of certain kinds of symptoms every time there's an announcement like this. I think about, there was the case way back where Liam Neeson's wife died on a ski hill in Quebec after hitting her head, and we had a hugely increased awareness of head injuries and what people should do after head injuries after that happened. And I think, I believe that we'll probably see something similar after this. And so some of it is paranoia, but in the end, I actually think awareness is always a good thing. I think that a lot of people out there tend to ignore their health. They tend to ignore what their body is telling them. And I think that really one of the key things to treating cancer, especially effectively, is to recognize and catch it early. So, I would say to anybody out there, especially when we're talking about brain cancer, one of the things people should be aware of is if you're experiencing things that are just not out of your norm. So if you never get headaches and you're suddenly getting headaches, if you're getting things like double vision or nausea that can't be explained, that doesn't go away, or even sudden personality changes, or if people have seizures and they've never had them before, these are all the kinds of things that have to be investigated. You can't ignore these things. So, I think a lot of people tend to sweep things under the rug, and the benefit of if there's one benefit we can identify of a tragedy like this, is that it maybe will help to prevent further tragedies in the future.
Exactly. And I mean, especially here in Canada with our great healthcare system. Jay or Roddy, I know you're here. You're big fans. Roddy, do you have any questions for Dr. Belchetz as he joins us?
Not really. He's explained it pretty well.
Yeah, it's been pretty amazing, actually. Jay?
Yeah, this is just sad. It's a sad, your explanation actually made me a little more depressed, to be honest with you. A sad day for a lot of Canadians in the whole country, I think.
Well, yeah, I mean, it's a horrible thing to be talking about, and obviously, going through the details and realizing how grave this is a very sad thing for everybody. But I think, if there's one thing to be said, recognizing the gravity and for us to have knowledge of the gravity of the situation while he's still got time and health to actually enjoy the days he has left, I think there is some positivity to be said that, he knows how much he has to take advantage of the time he has left. And that is something not really respected. I think that is a pretty significant thing, and something that I think we, hopefully he's thankful for, and that we should all be thankful for, that he does have the time to really use his days to best effect.
I saw a brief clip of the press conference over at Sunnybrook here in Toronto. And one of the things, I forget, one of the reporters said a question like, hey, how are we going to celebrate this loss? And someone, I forget who it was on the podium, said basically, this isn't a loss, this is a gain, because just exactly that, what you're saying, Dr. Belchetz, is we get to live these last year or plus year, hopefully, with Gord Downie, and he'll be at his peak, he'll be at his prime, and he's going to give it and rock it out the way, same way he always has, and then see how much love, as Roddy on our program said earlier, how much love he actually has, and to take it all in. So it's almost a gain in some respects, but of course, ultimately, it is very tragic and sad. Brett, thank you so much for your time. You're so good at what you do, man. You really are.
It's my pleasure. Anytime, Fred.
Okay, thank you for explaining it to us so concisely. We're back in a moment here on Canada Laughs, Channel 168. I know we have laughs in the program, and on days like this, it's tough to ignore the sad. Here on Sirius XM, brought to you by Pete's Pizza.
And don't forget to subscribe now to our YouTube channel. Subscribe! Now! Hit the button! Do it! Do it now! Do it!